treatment of infertility in men. Surgical repair of the varicose vein if there is varicocele, which is the major cause of infertility in men. Because the sperms, if they are normally produced by the normal testicles, are pulled back or pushed back and is not conveyed onwards towards its goal, that is to the ejaculation and the installation and deposition in the sex partner vagina. So if there is pathology in the veins are complex tortuous one, they are excised by surgeon and the passage is maintained. So there is obstruction is removed, the sperm produced by the testicles, they are passed through the vas deferens onwards into the penile urethra, and later on in the during sexual intercourse it is ejaculated and deposited in the vagina during normal process of sex. Moreover, if there is any stricture, inflammatory, any compression, any mass polyp formation which produces obstruction in the reproductive organ system, starting from the testicles in onwards into the vas deferens and seminal vesicles, then it onwards into the penile urethra. During this passage, if there is any obstruction, that obstruction has been diagnosed by the ultrasound methods and surgeon remove the pathology or the obstruction or the material which is producing obstruction, that is removed, so that there is no obstruction in the passage of the sperm from the testes into the uterus, that is cleared one. So this is a surgical procedure to remove the obstruction. Any mass, any inflammatory process mass is removed. So the passage is cleared one. There should be no obstacle. Now, if the obstruction or the causes of infertility is not reversible one, then there is a procedure of artificial fertilization in vitro. We get sperms direct from the testes by syringing method, or we collect during sexual intercourse. If the male, if the passage of the sperm is normal, it can be collected during sexual intercourse. But if there is any obstruction, permanent one, then we direct collect the sperm from the testicle. On the other hand, we collect ovum from the sex partner of the men. Both are fertilized in the lab, and that cultivation ends in the fertilized egg ova, which is then deposited in the uterus, and the fertilization and the fetus formation is carried on. If the male sex partner is not producing sperms, absolutely nil, or to a very reduced quantity which is not able to produce fertilization or baby production, then we can, by the consent of the both sex partners, we can also inject sperm of a donor, and that is injected into the uterus of the female to produce the baby. So these are the various scientific artificial method of fertilization to satisfy or to carry on the human race for the infertile men. No prevention of the infertility. For that, to improve the health of the men, to reduce the infertility, to treat the person up to the maximum grade, the role of diet is very compulsory. Take abundant, sufficient quantity of purified pasteurized water daily. Have a regular aerobic walk. Your diet should be very healthy, consisting of fresh fruits, veggies, whole grain foods, lentils, nuts, fish, but you should avoid red meat and the saturated fat diets. So low fat dairy products you can take to get the health and to boost up the spermatogenesis process. Also, you should manage to reduce your stress and depression conditions by adjusting your environment, friendship, and the hobbies and the daily activities. So these are the various process by which the infertile persons can be made fertile by the simple scientific way and methods.